Dr. Abigail Nyako, an ophthalmologist at the Komfo-Anokye Teaching Hospital in Kumasi, Ghana, had this to say on the topic of computer vision syndrome.
So computer vision syndrome is also known as digital strain, and this refers to a group of symptoms that a person experiences from using screens, computer screens. But in this discussion, if I mention computer screen, we are referring to a number of things. We are not just talking about computers, we're talking about computers, tablets, phones, all kinds of screens, e-screens, e-readers. So this group of symptoms, which is referred to as computer vision syndrome, comes about from using these screens for a prolonged period of time, especially if the person has to continuously use these screens for 2 hours or longer than that. Now, these symptoms come about because in staying glued to the screen for that long, the person is not able to carry out usual physiological things that if they were not fixated on the screen they would be doing, which includes blinking and then taking their eyes off to take a break. So what happens when a person is glued to a screen is that you don't blink as often as you usually would if you were not glued to a screen, and that affects how your eye distributes tears in front of the eyes. So in any person, any normal person, you have what we call a tear film in front of your eyes, which helps. We are not aware of it, but then that is what makes our eyes comfortable. Now, when you are fixated on a screen, you don't blink as often. So this means that you don't spread tears over your eyes that often, and then you begin to get uncomfortable when that happens. So when a person has computer vision syndrome, some of the symptoms they will be having will include eye strain. For some people, it's as severe enough as to get headaches, forehead pain, pain at the back of the head. For some people, they feel like the eye is burning, like someone has poured some pepper on it or something. And then for some people, they feel like they have sun grains on their eye. So all those are some of the things a person experiences when he has computer vision syndrome. And all this is because your eye is doing too much work at a very close distance than you usually would if you were not glued to a screen. When you have to sit behind a computer to work, or if you have to work with any other screen, make sure the screen is at an angle of 10 to 20 degrees tilted away from you. Okay, the screen shouldn't be flat or tilted towards you. That affects the angle at which your eye has to look at the screen, and then it increases your discomfort. So the screen has to be about 10 to 20 degrees away from you, and then also the distance between your eyes and the screen should range between 50 to 70 centimeters, which also translates to about 20 to 28 inches. But because we are used to centimeters, 50 to 70 centimeters should be comfortable for a person to work with. Also, you should consider the lighting in the room you are working at. Position your screen such that the lighting in the room does not cause glare on your screen. So if necessary, you might have to close your windows or put blinds or some curtains on your windows in order to avoid and reduce the amount of light that comes in. The reason being that when that light falls on your screen, it's going to cause glare onto your eyes, and then your eye has to try to overcome that glare as well as give you a clear vision of the screen you are working with, and that's a lot of excess work for the eye to do. Another thing you can do is what we call the 20-20-20 rule, 3 20s, a triple 20. After working continuously on your computer screen or whichever screen you are working with, whether it's your phone, whether it's your tablet, whether it's an e-reader, continuously for 20 minutes, you need to take a break for 20 seconds and then look at an object that is 20 feet or 6 meters away from you. And this is important because all the work you are doing on your screen is what we call near work. Everything you are looking at is very close to you. So your eye has to do a lot of what we call accommodation in order to give you a clear image of the near work you are doing. So that is a lot of strain. And then once you take that break and you look away, it breaks away from that excessive accommodative work it's doing. And then your eye can relax for a while, for that 20 seconds you are looking away before you come back to working on the screen. If the print you are looking at is really small, then your eye has to accommodate more to give you a clear view of whatever you are looking at. The bigger the images are, the better your eye has, the less work your eye has to do to see clearly, right? So if you can afford to increase your font size, that is better than shrinking your font size. It puts more strain on your eye eventually.